practice session with MiTio. Welcome. As usual, before the class begins, let me go over some reminders. Everyone must arrive on time, stay the full hour, and participate in order to receive credit. Please do not activate your cameras and stay muted throughout the session until I call your name. Please make sure you mark your attendance using the links that I provided in the chat box, and I will give you the proof of attendance award at the end of the session. For those of you who would like to observe, please let me know by using our hand up emoji at the beginning of the class, so I can do the head count of those who are actually participating, so to divide the time evenly between the participants. Also, if you're a first-time student, you may observe to see what to expect from the sessions. Any questions you can ask, questions regarding the course, you can ask by attending Dr. Lee's Q&A sessions that take place twice a week, and on Tuesday 6 p.m. Eastern Time and Thursday 11 a.m. Eastern Time, and the links are shared in the chat box for you as well. Please, for the session, keep your dictionaries ready and open, and try to use the standard medical interpreter protocol when you refer to yourself in the third person when asking for clarification, verification, moment to look up a term, or requesting a repetition. Write down any new terminology, and also if a new term, an unfamiliar term pops up, even if it's not your turn to interpret, if you hear it, please make sure you check it and write it down in case it appears in your segment. You don't have to, use up your time by looking for the terminology. Plus, it will also allow me to see who's actually listening and who's not. Write down any new terminology so you can study at a later time. And we also recommend that you use WebMD and Medline Plus for your individual practice. Do not rely just on these sessions only. If you have any resources you find interesting and helpful, please share them with us at the end of the session. We use our chat box here also for peer assessment. When we have students who speak the same target language, you're more than welcome to help each other with terminology, suggest better version of interpreting certain word or phrase. Also, don't forget to compliment each other as well. Class is kept to 20 participants only. Anything above it is whoever arrives after the class already has 20. You will be just observers, but you can still use this hour to practice your note taking and writing down new terminology. Coaching sessions, one-on-one coaching sessions, and one-on-one live practice sessions are also available, and the link to book those sessions with one of our facilitators is provided in the chat box. Okay, now one more thing. I would ask you to not ask me questions in the chat during the session, because I simply physically cannot see those questions popping up. Hold on the questions until the end of the session, and I will get back to you to answer those. Okay, let me see if anyone volunteered to be an observer. Doesn't look like it. So we have 18 participants. I believe I have you all here. If not, if I missed anyone in my roster, I will ask whose name I missed. Okay, we're ready to start. Let me get my stopwatch. First one to go is going to be Danielle. Our topic is Russian. Oh, let me change my language here. I'm typing in Russian for you. Okay. Daniel, are you with us? Your microphone is not working. Yes, go ahead, and I'll get back to you when you're back. Yes, no problem. Okay. So I'm getting back to Daniel. L would be next.
Hello.
Yes, good evening. Can you hear me okay?
Yes, I do. Good evening.
Perfect. Okay, let's start. Um, so the doctor is talking to the father of the patient. So tell me what was going on last week in the ER.
ممكن بس تخبرني شو صار معاك الأسبوع اللي طاف في غرفة المستعجلات؟
Well, Maria said that she felt a lot of pain in her back and in her private parts. She was crying.
ماريا قالت إن في عندها ألم كتير في ظهرها وكمان في المناطق الحساسة، كانت بتبكي كتير.
My wife and I had to take her to the ER.
زوجتي وأنا وديناها لغرفة المستعجلات.
Could you tell me a little bit about what was happening with Maria before you took her to the ER?
ممكن بس تخبرني أكتر شو صار مع ماريا قبل ما تاخدوها على غرفة الاستعجالات؟
Yes, doctor. She was absent from school several times last week.
نعم دكتور، يعني اتغيبت عن المدرسة الأسبوع اللي طاف كذا مرة.
That particular morning, I told her to get up and get ready to go to school.
وخلال هذاك الصباح خبرتها أن تستيقظ وتستعد لتذهب للمدرسة.
She woke up, dressed, and walked out of the door.
استيقظت، حطت ملابسها وطلعت من الغرفة.
Then she suddenly ran into the house again and lay back down on the bed.
وبعدها دخلت مرة تانية للبيت وراحت لغرفتها واستلقت على السرير.
I went in to talk to her, and she said that she felt her body hurt too much
رحت لأتكلم معاها فخبرتني إنه كل جسمها بيوجعها.
and that she wouldn't be able to go to school that day.
وإن ما تقدر تروح للمدرسة خلال هذاك اليوم.
My wife came in to talk to her, and uh, uh, then she felt, wait a second, and then Maria told her mom that she felt pain in her back and her private area.
وكمان زوجتي رجعت لتتكلم معاها وبعدين ماريا خبرتها إنها بتحس بألم في الظهر وبالمنطقة الحساسة.
Okay, thank you, El. Good job.
Thank you.
Daniel, looks like you're back.
Hi, Tatiana. Thank you for
Hi.
your
Okay,
patience.
I can hear you. Okay, let's continue the same topic. So, did the doctor at the ER say that she had found anything?
¿Y el doctor en el departamento de emergencia dijo que encontró algo?
No, we stayed at the hospital for a few hours and then went home without Maria.
No, nos quedamos en el hospital por unas horas y después nos devolvimos a la casa sin María.
Okay, like I said before, there are many things that can accompany her depression.
Ok, como dije medical interpreter needs to look up a word.
Sure.
Ok, lo que dije antes, medical interpreter needs repetition.
Like I said before, there are many things that can accompany her depression.
Como dije antes, hay muchas cosas que pueden acompañar su depresión.
It includes complaining of physical problems as well as mental problems.
Puede incluir problemas físicos y también mentales.
I understand that because of her depression, she feels like she's unable to perform daily activities.
Entiendo que por su depresión, ella no puede completar unas actividades de día a día.
For example, she may not care enough to get out of bed or get dressed.
Por ejemplo, ella de pronto no le importa salir de la cama y vestirse.
Much less work, do errands, or socialize.
Mucho menos trabajar, participar socialmente o hacer vueltas.
These feelings of sadness and other symptoms make it hard for her to get through the day.
Estos sentimientos de tristeza lo hace muy difícil vivir día a día.
I know. And I try to talk to her every day when she comes home from school.
Lo sé y trato de hablar con ella cada vez que viene de la escuela.
But she rarely says anything to me. But I'm glad that she talks to my wife about her feelings.
Ella muy raramente habla de eso conmigo, pero me alegra que habla con mi esposa sobre eso.
Okay, very good. Thank you.
Thank you, Tatiana.
Florence?
Hi.
Hello. Continuing with the same topic. How about her sleep? Does she get enough sleep at night?
Ni gute ku bijyanye no kuryama? Aryama neza ijoro ryose?
She wakes up several times a night and won't be able to fall back asleep until 5 in the morning.
Abyuka inshuro nyinshi zishobotse nijoro kandi ntabwo ajya asubira kuryama kereka saa 11 za mu gitondo.
I think that's why she misses so much school.
Ngira ngo niyo mpamvu ajya asiba ku ishuri.
Try to get her outside during the daytime as much as you can.
Jya ugerageza kumujyana hanze inshuro nyinshi zishoboka.
Focus on activities that make her feel better.
Ujye ugerageza kumujyana mu myitozo ashobora kwiyumva neza.
At home, try to encourage her that it's important to do things for herself and not to isolate herself.
Ujye ugerageza kumubwira mu rugo akore ibikorwa wenyine adafashijwemo n'undi muntu.
Encourage her to take part in activities even when she may not want to.
Ujye ugerageza kumwumvisha ko agomba gukora imirimo nubwo aba atabishaka.
Such activity may actually make her feel better and help her maintain regular sleeping pattern.
Imyitozo akora umunsi ku munsi niyo ishobora kumufasha kujya asinzira neza.
I have already spoken to her about this earlier.
Mu by'ukuri nagerageje kumuganiriza ibi ngibi mbere.
She mentioned to me that she was going to participate at some volunteer work at school.
Yambwiye yuko azajya yitanga mu bakoranabushake bo ku ishuri.
Yes, she's going to do that, but I'm not sure when she'll start that.
Yego azakora ibyo ngibyo ariko sinzi neza igihe azatangirira.
That's good. At least she has some ideas on things she wants to do.
Ni byiza nibura afite ibitekerezo by'icyo ashaka gukora.
Just as long as she is willing to do something.
Byaba byiza atekereza kugira icyo akora.
Does she get enough medication? Does she have enough medication until the next time I see her?
Ese afite imiti ihagije kugeza igihe nzongera kumubonera?
Yes, I think so.
Yego ndatekereza.
Okay, thank you, Florence. Good job.
Thanks.
Gustavo is next. Gustavo? Do we have Gustavo? We did, but we don't anymore. Okay. No, you're there. I can see your microphone on. There is no sound, Gustavo. I'll have to get back to you. We have to move on. We have full class. I'll get back to you at the end. Huang Wu?
Yes, I'm here.
Okay. We are switching to leg pain. Hi, my name is Joanna. How are you today? Do you have any pain right now?
Xin chào bạn, tôi là Joanna. Bạn có bị đau cái chân không?
It's all right now, but it was so bad during the night.
Bây giờ thì nó khỏe không sao, nhưng mà nó rất là đau vào buổi tối.
We're going to do some exercises today, like riding the bicycle.
Dạ, thì bây giờ chúng ta sẽ làm một cái tập thể dục ngay chỗ cái xe đạp này.
You can sit on here, raise the pedal and push around.
Bây giờ bạn ngồi xuống đây và nhấc cái chân lên, nhấc cái bàn đạp lên. Và bây giờ bắt đầu chúng ta bắt đầu làm.
I don't know why my leg is okay, but my left leg is okay, but my right leg always slides off the pedal.
Tôi không biết tại sao là cái chân bên phải thì nó không sao, mà chân bên trái thì khi nào nó cũng rớt ra khỏi cái bàn đạp.
It's okay. Let's go to this bar. How about your hip?
Thưa không sao, thì còn cái hip còn cái xương chậu của bạn thì sao?
Has it been hurting?
Có bao giờ bị đau không?
It's been okay.
Nó không sao, từ bữa giờ nó không đau.
Good. We're going to do some different steps today.
Vậy thì không sao, thì bây giờ mình sẽ làm thêm những cái bước khác.
It'll be a little more intensive than we've been doing.
Mình sẽ làm khó hơn một tí hơn là những cái gì mình đã làm.
I want you to lay on your side and raise your leg up and down for 5 minutes on each side.
Ok, bây giờ mình nằm với bên tay phải và nhấc cái chân lên 2-3 lần phong mỗi bên.
My legs are getting tired now.
Cái chân của tôi thì bây giờ mệt lắm, mỏi lắm.
I'd like to try another exercise. Sit up straight and try to kick your leg straight out.
Chân của tôi mệt, bây giờ tôi muốn làm một cái tập thể dục khác và ngồi thẳng và đưa cái chân ra.
I want you to do one leg at a time, 15 repetitions each side, and then we'll see how you feel.
Ok, bây giờ ngồi xuống và đưa cái chân lên mỗi 15 lần và để coi bạn cảm thấy như thế nào.
Okay, thank you.
Thank you.
Okay, Gustavo, let's see if your mic is really working. Gustavo? Gustavo? I cannot hear you, and I'm sorry, I cannot wait. I will get back to you again. Mariana is next, and we are switching to primary care visit.
Good evening, Tatiana.
Good evening. Okay. Hello, Boris. So what's going on?
Здравствуйте, Варис. Ну что происходит?
What's the name of the patient?
I heard Varis.
Yeah, Boris.
Oh,
That's how they
Boris.
say it in English, but you know what it actually is.
Okay.
Мгм.
Борис. Здравствуйте, Борис. Как у вас, что с вами происходит?
У меня болит горло. Ну, вообще-то горло не болит, просто такое ощущение, как будто оно опухло.
My throat hurts. Actually, it doesn't hurt, but it feels like it's swollen.
Как будто что-то давит на заднюю стенку горла.
It feels like something is pressing on the back of my throat.
How long have you had that feeling?
Сколько у вас уже это ощущение продолжается?
Около суток.
About 24 hours.
And you said your throat was not painful, right?
И вы сказали, что у вас горло не болит, да?
Нет.
No.
Is it hard to swallow?
Вам тяжело глотать?
Нет, но когда я ложусь, я чувствую, как будто горло закрывается, я как будто давлюсь.
No, but when I lay down, I feel like my throat is closing and it's like I'm choking.
Do you have a fever or chills?
У вас есть температура или озноб?
Нет, я просто чувствую, что я не могу выдохнуть.
No, I just feel like I can't exhale.
Я могу вдохнуть, но что-то у меня в горле мешает мне выдохнуть.
I could inhale, but I feel like something is my throat is stopping me from exhaling.
Have you been ill lately? A cold or a flu?
Вы, может быть, у вас какие-нибудь заболевания были недавно? Простуда или...
Он.
Cold and flu?
Flu.
Простуда или грипп?
Да нет.
Not really.
Do you have night sweats? Are you constantly tired or have you been losing weight?
У вас вы потеете по ночам? Вы чувствуете, как будто вы все время уставший? Would you pretend the repetition of the last part?
Or have you been losing weight?
Или вы теряли вес?
Good job. Thank you, Maria.
Thank you.
Gustavo, let's try again.
Hello, Tatiana. Can you hear
Oh,
me?
there you are. Yes.
Oh,
Okay.
thank goodness.
Congratulations.
Thank
Okay,
you.
let's continue. No, I did have a tooth abscess, and I have been on antibiotics for several weeks now.
No, yo sí tuve un absceso en mis dientes y he estado en antibióticos por unas semanas ahora.
But I'm not having any problems with that now.
Pero yo no creo que tenga un problema de eso ahora.
What did your dentist prescribe for you?
¿Qué le prescribió el dentista para eso?
Amoxicillin.
Amoxicilina.
Mhm. Are you allergic to any medication?
¿Es usted alérgico? Ay, ay, ay. The interpreter needs to know the sex of the patient. I wasn't clear. I had to restart.
It's a male.
The interpreter needs repetition of the
Sure.
last.
Are you allergic to any medications?
¿Es usted alérgico a algún medicamento?
Codeine.
Soy alérgico a la codeína.
Have you been coughing a lot?
¿Ha estado usted tosiendo mucho?
Yes.
Sí.
All right. Let's take a look at you. Open your mouth, say R.
Muy bien, déjenme, lo vemos. Abra su boca, diga A.
Breathe in and out. Good.
Inspire y expire. Bueno.
Does it hurt when I feel your neck here?
¿Le duele a usted cuando yo toco aquí su cuello?
Yes.
Sí.
I'd like to start you on an albuterol treatment.
Me gustaría comenzarle un tratamiento con albuterol.
This should help you cough.
Esto le va a ayudar a toser.
I'm also going to send you for soft tissue x-ray of your neck.
También me gustaría mandarlo a una radiografía de tejido. Interpreter needs time to get away.
Soft tissue of your neck.
Soft tissue.
Mm-hmm. You're being helped in the chat.
Me gustaría mandarle a tomar una radiografía de tejido blando de su cuello.
Mm-hmm. Okay, very good. Thank you.
Thank you.
Nicole is next.
I'm right here.
Okay, good. We're losing people left and right. ER visit.
Okay.
Okay. Hello, I'm Dr. Richards. So you're feeling sick. How long have you felt ill?
Hola, soy el doctor Richard. Entonces, ¿usted se siente enferma? ¿Por cuánto tiempo ha estado enferma?
Oh, it's been a while now. I started feeling nauseous maybe 10 days ago.
Ha sido un tiempo ya. He sentido náuseas por un corto tiempo, 10 días.
I'm tired all the time. My heart beats very fast and I've been vomiting.
Me siento cansada todo el tiempo, mi corazón late muy rápido y siempre estoy vomitando.
And it just hasn't gotten any better. It's also worse at night.
Y no ha mejorado para nada. Y en las noches se pone peor.
When I lay down, it feels like I'm choking and like I can't breathe.
Cuando me recuesto, siento que me asfixio y no puedo respirar.
I went to see Dr. Rizardi last week.
Fui a ver al doctor Rizardi la semana pasada.
What's the name of the doctor?
Rizardi.
Okay. Just kind of didn't hear it in the sentence. He said I have an irregular heartbeat and that there is water in my lungs.
Él dijo que tenía un latido irregular del corazón y que había agua en mis pulmones.
He gave me some more medicine, but ever since then, it feels like my heart is racing.
Él me dio unos medicamentos, pero desde ahí siento que mi corazón late más rápido.
And like I said, I have this feeling that I can't breathe.
Y como le mencioné, siento que no puedo respirar.
Did something different happen tonight to bring you into the ER?
¿Algo pasó diferente que lo trajo a la emergencia el día de hoy?
I became very lightheaded and dizzy.
Me sentí un poco mareado. I think in English.
Oh yeah, I know you have the same problem as we do have in Russian with dizzy and lightheaded.
Okay.
Well, but Everest gives you
Yeah,
an option here.
Thank you.
Because actually there is a difference, but it's hard to find the right word.
Yeah.
Yeah. Lightheaded, we almost have to say it like with our several words in Russian. Okay.
Right.
Okay. Thank you. Good job.
Thank you so much.
Shumei?
Hi, Tatiana. Can you hear me?
Yes, I can hear you. Let's continue.
Mhm.
So let's see how it is with you with the lightheaded. So I became very lightheaded and dizzy.
我觉得头轻脚重，然后头晕。
It became so bad that I started sweating and I felt like I had to vomit.
就变得很严重，我觉得我就开始流汗，然后我想要吐。
Who called the paramedics?
是谁去叫那个急救呢？
My daughter.
哦，我女儿。
Were you conscious when the paramedics arrived?
你头脑清楚吗？当救护人员到达的时候。
Yes, I was.
是的。
Have you been experiencing any chest pain or pressure or squeezing sensation in your chest?
你有觉得胸口有压力吗？或者是挤压，或者是收缩的感觉？
Sorry.
没有。
Have you noticed any blood in your stool?
你有看到有任何血液在你的粪便上面？
Oh no.
没。
How often are you vomiting?
你吐多几次呢？
Mostly just when I lay down, I get so choked up, I have to sit up.
大部分的时候是我躺下来的时候，然后我觉得不要窒息了，我就要坐起来。
And then I cough until I vomit.
然后我就咳嗽，一直到我吐。
Have you noticed any blood in your vomit?
你有注意到有任何血液在你吐出来的东西吗？
No.
没有。
Are you allergic to any medication?
你有对任何药物过敏吗？
Tylenol with codeine and ibuprofen.
Tylenol 有 codeine 的东西，还有 ibuprofen。
And what medication are you on now?
那你现在是有吃什么药物呢？
Last week, Dr. Rizzardi put me on Lasix, Toprol, Lanaxine, and Coumadin.
上周Lorenzo 医生给我这些药物interpret needs reputation for all those.
Okay, we'll have to stop here. We'll have to switch students. Our time is running out. Okay, thank you.
Thank you.
Thank you, Shumei. Stefano is next.
Hi, how are you doing?
Yes, very well. Thank you. Let's see how you do with the medication list. I hate it too. Okay, last week, Dr. Rizzardi put me on Lasix, Toprol, Lanaxine, and Coumadin. And believe me, I'm going very slow, much slower than the doctors.
Could interpreter request how to spell the second medication, please?
Toprol.
Oh, okay. Oops. 1 second, my computer's lagging. Let me Okay. Okay. Excuse me, interpret request for repetition.
Last week, Dr. Rizzardi put me on Lasix, Toprol, Lanaxine, and Coumadin.
Lasix. Okay.
May I ask you what the difficulty is? You basically give the list back. You don't even have to interpret the names, or you don't have enough time. Did you have trouble taking notes? Was that the?
Trying to find the name in the target language.
No, do not do that.
Okay.
No, there is no such thing as target language, or because what the doctor says, it's going to be prescribed here. They pick it up here. When they go to the pharmacy, they're going to use that name. If you're in the opposite situation, which like happens a lot, say with Russian patients, when they start giving us Russian names of medication, even with that, I have to give it in Russian first, whatever they say. And then sometimes you have to Google together with a doctor to find out what the equivalent is, because in most cases, a lot of it, some of it is not approved by FDA, or it's a completely different deal. So there is no interpreting of medication.
Okay, that makes it much easier.
Of course, yeah.
Okay, so interpret request for petition one last time.
I thought you wrote it down, no?
I did. But not the entire statement.
Okay, so last week, Dr. Rizzardi put me on Lasix, Toprol, Lanaxine, and Coumadin.
La última semana el doctor me puso en Lasix, Toprol, Lanaxine y Coumadin.
Okay, and you will not believe it, but our time is up. So this is a great example how a simple thing can become pretty difficult when we didn't manage to write it down. And I get it. I understand. When they give you long lists, and especially when they go fast, which I wasn't, it can be a real problem. And yes, you would have to ask a request a repetition. Okay, Velia?
Hi.
Hi. Okay, so just for fun, let's go with the same sentence. So last week, Dr. Rizzardi put me on Lasix, Toprol, Lanaxine, and Coumadin.
La semana pasada el doctor Rizzardi me puso en los medicamentos Lasix, Toprol, Lanaxine y Coumadin.
Okay. Were you ever hospitalized?
¿En algún momento estuvo hospitalizado?
Yes, for atrial fibrillation with congestive heart failure.
Sí, para fibrilación atrial. Interpreter needs a moment to look up a word.
Of course.
Y insuficiencia cardíaca congestiva.
Has anyone in your family died of heart disease?
¿Alguien en su familia ha muerto de enfermedad del corazón?
No.
No.
All right. I'm going to listen to your lungs. Take a deep breath and exhale slowly.
Bueno, voy a escuchar sus pulmones. Respire profundo y exhale.
Now breathe normally.
I'm so sorry. Interpreter needs repetition of the last sentence.
Now breathe normally.
Ahora respire normalmente.
Okay, I'm going to do a rectal exam on you. You might feel some discomfort, but it shouldn't hurt.
Ok, muy bien. Le voy a hacer un examen rectal. Quizás sienta algo de incomodidad, pero no debe dolerle mucho.
Can you turn on your side, please?
¿Puede ponerse de lado, por favor?
We need to put a special IV in your wrist because we're having trouble reading your blood pressure.
Necesitamos ponerle tubo intravenoso en su muñeca especial porque, I'm sorry, interpreter needs repetition.
Yeah, so it's special IV in your wrist because we're having trouble reading your blood pressure.
Estamos batallando para leer I'm sorry, interpreter needs a moment to look up a word.
Okay, I will have to move on, but you still please look it up. Okay. Okay. Sorry, we have full class. Need to move on. Leticia is next.
Hello.
Hello. Switching to oncology visit. Hello, my name is Colleen. I work with your surgeon. How are you doing today?
Sí, bueno, mi nombre es Colleen, trabajo para el sargento.
My back hurts today. I had surgery on my back a little while ago.
Mi espalda me duele. Tuve una cirugía un tiempo atrás.
When was that surgery?
¿Cuándo fue la cirugía?
I believe it was about 4 weeks ago.
Creo que fue como 4 semanas atrás.
Do you have any other complaints?
¿No tiene algún otro alguna otro síntoma?
Complaints, would that be, is that the word for complaints?
¿Quejarse? ¿Otra queja?
Are you currently, no, sorry. Okay, no.
No.
When was the last time you were seen at the clinic here?
¿Cuándo fue la última vez que la vimos aquí en la clínica?
Are you currently on a round of chemotherapy?
Ok, vine alrededor de que me hicieron la quimioterapia.
Yes, my 4th.
Sí, como 4.
Have you gained or lost weight?
¿Ha subido peso o ha bajado?
Yes, I've lost about 5 pounds.
Sí, perdí como 5 libras.
Are you still on Praxinazole?
¿Todavía está en Pranaxol?
Yes.
Sí.
Are you having any shortness of breath?
¿Tiene falta de respiración?
Not really, but I use the inhaler as needed.
En realidad no, pero uso el inhalador cuando lo necesito.
Are you still on oxygen? And what level of oxygen are you on?
¿Todavía usa el oxígeno? ¿Y qué clase de oxígeno está usando?
Yes, between 2 and 3.
Sí, en medio de 2 a 3.
Do you have any complaints?
¿Tiene alguna queja?
No.
No.
How often do you use the inhaler?
Cada y cuando usa el inhalador.
Okay, very good. Thank you. Maria?
Hello.
Yes, good evening. Continuing the same topic. Usually about 2 or 3 times a day. I would say about 7 times in the last few days.
Normalmente como unos 2 o 3 veces, pero yo diría como 6 veces al día.
Is it okay for me to examine you?
¿Está bien si le puedo examinar?
Sure.
Sí.
Take a deep breath in and out.
Respira profundo afuera y para adentro.
The surgical area looks really good. Have you been eating all right?
El lugar de la cirugía se ve bien. ¿Ha estado comiendo bien?
Yes, it's fine.
Sí, está bien.
Do you have any swelling in your legs?
¿Tiene algún hinchazón en las piernas?
No, they look pretty good. I'm actually feeling much better now.
No, se ven bien. Me siento mucho mejor ahora.
Great. Are you still taking the medications on this list here?
Está bien, qué bueno. ¿Aún estás tomando los medicamentos aquí en este listado?
Yes, of course.
Sí, claro.
How many pain pills do you take a day?
¿Cuántos medicamentos de dolor tomas al día?
1 every 4 to 6 hours.
1 cada 4 a 6 horas.
How many on a scale of 1 to 10, 10 being the worst, how much pain are you in right now?
En una escala 1 al 10, con el 10 siendo muy grave, ¿qué dolor siente ahora?
6.
6.
That's pretty high. Would you say you're feeling pain or discomfort?
Eso es muy alto. ¿Usted diría que está sintiendo dolor o descomodidad?
Pain, but I assumed that it was common to have pain like this because I had surgery only a few weeks ago.
Dolor, y pues pienso que es común porque acabo de tener una cirugía hace unos días.
It depends on what's causing the pain. I will give you some pain medications.
Depende qué es lo que está causando el dolor. Voy a darte unos medicamentos para el dolor.
Make sure you take it as needed.
Por favor, tómalo como recomendado o como lo necesite.
Okay, very good. Thank you. Everth?
Yes, Tatiana, can you hear me?
Yes, I can hear perfectly. Switching to carpal tunnel syndrome.
Oh.
Okay, let me... Okay, I'm not going to start from the beginning of the dialogue, all the pleasantries, hellos. Let's switch to the hard stuff. Today, I'm going to send you to the injection department so that you can get your shot with your public aid insurance.
El día de hoy lo voy a enviar al departamento de aplicación de inyecciones para que lo puedan ayudar con su seguro médico de ayuda pública.
Does your back pain radiate into your legs?
Interpretation, please.
Does your back pain radiate into your legs?
¿El dolor que usted tiene en la espalda se le expande a las piernas?
Yes, that usually happens when I stand for a long time on my right leg.
Sí, eso suele pasar cuando paso mucho tiempo parado sobre mi pierna derecha.
Are you taking anything for the pain right now?
¿Está tomando algo para el dolor en estos momentos?
I'm taking ibuprofen.
Estoy tomando ibuprofeno.
It's from here or did you buy it over the counter?
¿El medicamento es de aquí o se lo compró sin receta?
I bought it at the store.
Lo compré en la tienda.
Did you bring any medications you are on with you today?
¿El día de hoy trajo algún medicamento que actualmente esté tomando?
No.
Nope.
Okay, please make sure to bring them with you next time. Do you take Soma? S-O-M-A.
Por favor, asegúrese de traerlos la próxima vez que se presente. ¿Toma un medicamento que se llama Soma?
No.
No.
Are you breathing okay?
¿Está respirando bien?
Yes.
Yes. Sí.
How about fever or upset stomach?
¿Ha tenido fiebre o le ha dolido el estómago?
No, nothing at all, except that I seem to be sleeping a lot and I'm feeling more and more anxious.
No, nada en lo absoluto, excepto que he notado que estoy durmiendo más de lo usual y que me siento muy, muy ansioso.
Anxious about the tingling in your wrist or the possibility of surgery?
¿Ansioso por el cosquilleo que tiene en la muñeca o ansioso por la posibilidad de una cirugía?
The surgery would be very simple, small surgery.
La cirugía va a ser algo muy simple, es una cirugía pequeña.
Okay, perfect, thank you.
Thank you very much, Tatiana.
Julissa?
I'm here.
Okay. Continuing, same topic. The surgeon will cut right here and will take a small amount of tissue out.
El cirujano va a cortar en su mano aquí y va a tomar unas partes de su mano que son, interpreter needs to look up a word.
Of course.
Tejido.
Is that tissue?
Mm-hmm.
Mm-hmm. This will eliminate the pressure on the nerve.
Esto va a quitar la presión interpret needs repetition at the end.
The pressure on the nerve.
La presión en el nervio.
So that you don't feel any tingling anymore.
Para que ya no puedas sentir cosquillas nada más.
So what do you think about this?
¿Qué es lo que piensa usted?
I don't know. I'll have to think about it.
No sé, déjame pensarlo por un rato.
On the one hand, the tingling is interfering with my ability to work, with my ability to sleep.
Las cosquillas que me están dando, tengo problemas cuando estoy durmiendo o cuando estoy trabajando.
But I'm really afraid of surgery.
Pero tengo miedo a la cirugía.
Well, we can talk about this a little more later.
Pues podemos hablar más sobre esto al rato.
Can you sit up here, please, and take off your socks?
Si pudiera sentarse aquí y quitarse sus calcetines.
Now relax your leg.
Ahora relaja sus pies.
Now I want you to bend your knee up to your chest.
Ahora quiero que doble su rodilla a su pecho.
Now straighten it.
Ahora estírala.
Now back up.
Ahora hacia atrás.
Now pull your toes up.
Y ahora levante sus dedos para arriba.
Now pick your ankle up.
Ahora levante su tobillo para arriba.
Does your left leg hurt you?
¿Te duele tu pierna derecha? Izquierda? Sorry.
No.
No.
Is your stomach okay?
¿Su estómago está bien?
Okay, very good. Thank you. Marjorie?
Yes, hi, good evening.
Yes, good evening. We are switching to ENT. Oh, where am I typing? ENT. Everybody knows what ENT stands for, right? No? Okay. Okay, good morning. I'm Dr. Kim. What brings you in to see me today?
Buenos días, soy el Dr. Brink, que lo trae el día de hoy.
Dr. Kim.
Dr. Kim, I'm sorry, que lo trae el día de hoy.
I've had a runny nose for the past 2 weeks.
He tenido la nariz como que era en las últimas semanas.
I tried to clean it out, but it started to bleed, so I stopped trying to get it out.
He estado tratando de limpiarlo, pero ensangrado, así que lo detuve.
Any dizziness?
¿Algún mareo?
Sometimes because of my diabetes and high blood pressure problems, but not regularly.
Algunas veces debido a mi diabetes o por mi presión alta. I interpret needs repetition in the last part.
Yeah, but not regularly.
Pero no regularmente.
So I'd like to review what you've just told me. So you had thick nasal discharge. What color was it?
Voy a revisar lo que usted me ha dicho. ¿Qué color? Interpret needs repetition.
What color was it?
¿Qué color era?
Like the color of water.
Como el color del agua.
Has that happened before?
¿Le ha pasado antes?
No, sometimes during the winter, but not like this.
No, algunas veces durante el invierno, pero no así.
So was it thick and watery?
¿Fue espesa y aguada?
No.
No.
Was it bloody?
¿Fue sangrilolienta?
No, blood only comes out if I try to clean my nose out.
No, la sangre solamente aparece cuando trato de limpiar.
You also reported that you've had some problems with your ears. Is that correct?
Usted también reportó que ha tenido algunos problemas con sus oídos. ¿Es eso correcto?
Can you describe for me what the problem is?
¿Puede describir por mí cuál es el problema?
My hearing is getting worse.
Mi audición se está volviendo peor.
Okay, very good. Thank you.
Thank you.
Giancarlo? Giancarlo?
Yes.
Okay, let's continue. I've had problems hearing for a long time, but now it's getting worse.
Has tenido problema escuchando por un largo tiempo, por ahora se está peroneando.
Sometimes when I wake up, I can't hear anything at all out of that ear.
What ear? Specific ear or? Excuse me. Hello. Did you
Sorry.
say that? Did you mention a specific ear, or you just said out of that ear?
Out of that ear.
Okay. Medical interpreter needs repetition, please.
Sometimes when I wake up, I can't hear anything at all out of that ear, and then I feel very dizzy.
A veces cuando me levanto no puedo escuchar nada de ese oído y me siento mareado.
It can last a few hours or a few days.
Puede durar algunas horas y a veces días.
Then all of a sudden my ear will pop and I can hear again.
Y después, repentinamente, mi oído explota y después puedo escuchar otra vez.
Once when this happened, I flew to see my daughter in San Francisco.
Una vez cuando esto pasó, yo cogí un vuelo a ver mi hija en San Francisco.
And when the plane took off, my ear popped and I could hear again.
Y cuando el avión took off, cuando el avión subió, mi oído explotó y pude escuchar. Despejo. Okay, thank you. Se despejó. Thank you. Yeah.
No, I wasn't sure who you were thinking.
Because in the chat, so
Okay,
they just
yeah,
gave me
okay.
a better way. So, yeah.
But lately, everything sounds very muted.
Pero en estos días todo se suena muy mudo.
When your ear pops, does it hurt?
Cuando tu oído explota, ¿duele?
Okay, thank you. Yeah, thank you, Giancarlo.
Okay, thank you.
Sure. Anya?
Hello?
Yes? Okay, we will continue with the same
Okay.
topic. So when your ear pops, does it hurt?
Когда ваше ухо лопнуло, оно болит?
I don't think we would lopnula in this case. That would be like bursted, like it actually, it basically like a damage. Pop. Mariano, do you have any idea how you would interpret when the ear pops? Okay, let's leave it. Keep it. We will think about it. I'm not giving you my version. I want you to think about it.
Okay.
Okay. So the patient says, "Нет."
No.
When you feel dizzy, do you also feel nauseous?
Когда вы чувствуете себя, когда у вас головокружение, вы чувствуете тошноту?
Да, меня иногда подташнивает.
Yes, sometimes I feel nauseous.
Тогда я должен прилечь на некоторое время, и вся комната идет кругом.
And I have to lay down, and the entire room is spinning.
И как я уже сказал, иногда это длится долго, несколько дней, но иногда проходит в течение нескольких часов.
And sometimes it happens for a few days, and sometimes it goes by for a few hours.
When did the hearing problem start?
Когда у вас начались проблемы со слухом?
Уже около 2 недель.
About 2 weeks.
How about your right ear? Any problems with your right ear?
Как насчет правого уха? Какие-нибудь проблемы с правым ухом?
Да нет, ничего.
No, nothing really.
How about your coughing? You mentioned a dry cough.
Как насчет вашего кашля? Вы упомянули сухой кашель?
For how long have you had this cough?
Как давно у вас этот кашель?
Уже 2 месяца.
About 2 months.
Okay, very good. Thank you.
Thank you.
Rosannes? Rosannes? Okay. Bibiana?
Hello, good evening.
Yes, good evening.
Hello.
Let's continue, Bibiana.
I'm here. I'm
Well,
Rosanis.
I will have to get back to you, Rosannes. Okay. Do you smoke?
¿Tú fumas?
Yes, I've been smoking for 15 to 20 years.
Sí, he estado fumando entre 15 o 20 años.
Okay, you also mentioned that you feel itching. Where do you feel the itching?
Tú has estado comentando de que también sientes como picazón. ¿En dónde?
All over my body.
Por todo mi cuerpo.
How long have you had the itching?
¿Por cuánto tiempo has tenido como la picazón?
For the last 3 or 4 days, but if I take a shower, it helps me.
Entre 3 y 4 días, pero si tomo el baño me siento mucho mejor.
What medications are you on now?
¿Con qué medicamento estás ahora?
I don't remember, but maybe you can find that in my medical history record.
Yo no recuerdo ahora, pero puedes mirar en mi historial médico.
The other doctor gave me 3 kinds of medications.
El otro doctor me dio 3 clases de medicamentos.
Do you have any allergies? Food allergies?
¿Tú tienes alguna alergia o alguna comida que te dé alergia?
Yes, doctor. I'm allergic to yogurt, tomatoes, onions, and all frozen foods.
Sí, doctor. Yo tengo alergia al yogur, al tomate, a la cebolla y ¿cuál más? What is the last word? I'm sorry.
All frozen foods.
Y toda la comida frisada.
Are you allergic to any vegetables?
Y también soy alérgica a los vegetales.
Only if they're frozen vegetables.
Pero solo si son frisados los vegetales.
Okay, very good. Thank you.
Thank you.
Rosannes, getting back to you.
I'm here.
Okay. Okay, let's
something
go.
called- Yes.
We're only going to deal with your ear and throat problems today.
Yo solo voy a ver los problemas de tu oído y tu garganta por el día de hoy.
I'm going to look into your left ear to see from where it's draining the most.
Yo voy a ver en tu oído izquierdo para ver cuál de los dos está drenando más secreciones.
Okay, now let me look into your nose.
Ahora déjame ver tu nariz.
Please open your mouth and say ah.
Por favor, abre tu boca y diga ah.
Okay, I don't see any drainage, but I can see some problems in your ear.
Yo no veo ningún drenaje, ninguna secreción, pero sí veo algún problema en tu oído.
Have you had a previous infection?
¿Tuviste una infección previa?
Yes, 30 years ago. Rosannes? No sound.
I'm here, Mama. Hello?
Yes?
I'm here.
Okay, I'm listening.
Yes.
So
Yo
30 years ago.
Hace 13 años tuve problema en ese oído, infección.
Did you have surgery on your ear?
¿Tú tuviste alguna cirugía en el oído?
Yes, in my left ear.
Sí, en mi oído izquierdo.
They put something in there and removed something.
Ellos pusieron algo ahí y removieron algo.
Do you know what the surgery is for? Did they use a drill?
¿Tú supiste para qué fue la cirugía? ¿Usaron un drill? como un taladro.
I don't think so. They cut behind my ear.
No creo, pero cortaron detrás de mi oído.
Let's see. You have a hole in your left ear. Did you know that?
Déjame ver. Tú tienes un hoyo en el oído izquierdo. ¿Tú sabías eso?
Yes, doctor. I think the hole is from the surgery I had.
Sí, doctor. Yo creo que el hoyo, el hoyito es por la cirugía que tuve.
Okay, very good. Thank you. Okay, according to my list, I've called everyone's name. Did I miss anyone? No?
I have a question.
Yes.
I couldn't hear when you say the word is codeine, the word for today.
I haven't said the word yet. I say it at the end of the session, and we're just now finishing.
Okay.
Mm-hmm.
Okay.
Okay. Well, you know what? Let's use codeine. Why not? Yep. Thank you for. Okay. Okay. I believe
Okay.
it was
Thank you.
with the E at the end. Okay. Any other questions? Anyone?
Tatiana,
Uh-huh.
you were asking me, by the time I actually unmuted myself, you moved on.
Okay.
Another version for popping? Trishit?
Yeah, it was щелкает в ухе, you know? Like
Щелкает, трещит, щелкает.
щелкает, yeah, because you know what he means, especially when he talks about like flying, right?
Yes,
Like
yes.
pop, like щелчок, то есть в ухе что-то, или как будто бы что-то лопается в ухе, right? Yeah, because what was Anya? What word did you use? Разрывается or something. That's a little bit too traumatic. That kind of shows like, you know, like something actually is like he's getting really hurt.
Хлопать?
Like щелчок, хлопок, yeah.
Хлопок, щелчок. Okay.
Я сказала лопнула.
Лопнуло. Нет, было вот там что-то было. Лопнуло, или ну, anyway, yeah, it was a little bit too damaging for the ear because he's more describing it like a pop, like more like a щелчок or yeah.
Хлопок.
Yeah, хлопок, щелчок. Yeah, even хлопок is kind of too much, right? Too loud.
Да.
Okay. Any more questions? Okay, then good job, everyone. I will see you next week.
Good night.
Good night.
You.
Good night, guys.
Thank you very much.
you.
Have a good evening, everyone.
Thank you.
Bye-bye.